how are you today?
Good, how are you?
Good. So my name is Maria. I'm going to be your student nurse today, okay? And we're going to be just doing a quick assessment on you. Is that okay?
Yes, ma'am.
All right, awesome. So let me go ahead and just wash my hands. I'm going to apply some gloves and then we'll get started, okay? Okay, I'm going to take some gloves and I'm going to put on my gloves here. All right, great. Okay, can I see your arm, please? Thank you. Can you just verify your name, first name and last name for me, please?
Valentina Lopez.
Okay, great, and that's what I have here in the chart. And what is your date of birth?
05/14/1998.
Okay, great. Have that too, matches. And what is your MRN number?
12345.
Okay, great. Any allergies to any medications that you're aware of?
No, ma'am.
What about any allergies to latex, to the environment? No? All right. Any food or tape allergies? Nope. Okay, awesome. So, thank you. All right, and I have all of that here in my chart. There are no discrepancies between the bands and the chart. All right, so Miss Valentina, I do have here your vital signs report, and I'm just going to read them to you so you're aware, okay? So I have your blood pressure as 120/78, and that's normal. Your heart rate at 72 and your respirations at 18, all within normal limits. Your O2 percentage, which is just how much oxygen you're getting in, is at 99%, so that's great. And your temperature was taken at 98.7 degrees Fahrenheit, 0.7 degrees Fahrenheit. So everything is within range, okay? Are you currently experiencing any pain?
No, ma'am.
Okay, great. All right, so let's go ahead and assess. Patient does know person. She was able to state her name and date of birth. Miss Valentina, do you know where we are right now?
In a hospital.
Okay, and do you know what today's date is?
September 14th, 19.
Okay, what year is it?
2020.
Okay. And as of right now, who is the current president of the United States?
Donald Trump.
Okay, excellent. So patient's level of consciousness is alert. Patient was able to express to me where the patient is today, what date it is, and current factual information. So patient does not present with any signs of distress. I'm just going to check and make sure that body parts are symmetrical. So, Miss Valentina, I'm just going to do a quick assessment on you, okay? Okay. See your hands. Yep. Okay. All right. Awesome. So, both sides of the body are symmetrical, and as I've stated before, patient's level of consciousness and awareness ×3. All right, so let's go ahead and check for your equipment. So I'm just gonna check your nasal cannula just to make sure. Okay, so there are no kinks in the tubing. There are no breakdowns around the nares, and I'm just going to make sure that the flow rate is as ordered by the provider. So we're gonna check. Yep. So everything matches what I have in the chart. And I'm going to check for your IV. So if you give me your hand, thank you very much. So there's no erythema at the site of the IV. There's no edema present at all. And then there are no kinks in the tubing. And again, I'm going to just make sure that we have the correct order and that it matches. And yep, everything is correct. Now, the current patient does not have a urinary catheter present. However, if she did, I would go ahead and assess the catheter accordingly. So now what we're gonna do, Miss Valentina, is I'm just going to assess your scalp. Is that okay with you?
Mm-hmm.
All right, great. So, all right. So there is even hair distribution throughout. There are no lesions, breakdowns, patches, or scabs at the scalp. The patient's overall skin color is even and according to ethnicity. And let's go ahead and document that. There are no current wounds on the patient. If there were, then I would go ahead and address as such. And what we're gonna do is just check for your skin turgor. So just going to, it's gonna be like a little pinch, okay? It shouldn't hurt. Okay, great. And let's just check your extremities here. Okay. All right. So no edema present on any of the extremities. Patient's skin turgor is good elasticity. Overall temperature of the patient is warm as well. And I'm going to just palpate for capillary refill. So if I can have your hands here. Okay. Capillary refill less than 3 seconds on the left hand. Capillary refill less than 3 seconds on the right hand. I'm just going to take your socks off, okay? Capillary refill less than 3 seconds on the right foot. And capillary refill less than 3 seconds on the left foot. Thank you very much. All right, so just going to inspect your ears, okay? All right, so no erythema or skin breakdowns or drainage from the left ear. Again, no skin breakdowns, no erythema or drainage on the right ear. Patient's pupils, if you could look at me, patient's pupils are even. They are equal. Patient's pupils and eyes are round. Miss Valentina, we're going to do a quick test, okay? So what I'm going to have you do is just look straight ahead, okay? And I'm going to have a light that's going to shine. Just continue to look straight ahead for me, okay? All right, light is shining. Pupils the patient's pupils have constricted. We're going to do it again. Okay, and the patient's pupil has constricted both on the right and the left, okay? And then what we're gonna have you do again is just focus on this pen here, solely without moving your head, just with your eyes, okay? Just follow it. Okay, great, thank you very much. So patient is reactive to light and is reactive to accommodation. The patient's sclera is white in color, and I'm just going to have you remove your glasses for a second for me. Thank you. And patient's conjunctiva is moist and pink. Okay. As mentioned before, there is no drainage or skin breakdowns at the nares. And go ahead and open your mouth and stick out your tongue for me. Excellent, thank you. And patient does not have any lesions present around the mouth. Oral mucosa is pink and moist. It's even in colors, and there's no dentures present as well. Can you go ahead and smile for me? Thank you. And patient's facial symmetry is symmetrical. Okay. All right, Miss Valentina, the last thing that we're going to do is we're just going to listen to your lungs, okay? Is that okay with you? Mm-hmm. All right, so what I'm going to have you do is just sit up. Okay. Then I'm going to have you face that way. Thank you very much. And I'm just going to expose your back a little bit, and that's so that I can listen to your heart, or I'm sorry, to your lungs better, okay? Because I don't want to do it over your gown here. Is this comfortable for you?
Mm-hmm.
Okay, great. Okay. Go ahead and just breathe normal. Okay, great. Thank you so much. All right, and let me just help you get comfortable here. Okay, all right, go ahead and sit back for me. So everything sounds great. Everything is cleared. So the right upper lobe is clear. Right middle lobe is clear. Right lateral lobe or lower lobe is clear. Left upper lobe is clear, and your left lower lobe is clear. So everything is good. Your breathing is great. Now the patient is not working for her breathing. I mean, it's not labored. She's not using her accessory muscles to breathe as well. And I do see at rest the chest expansion. But again, it's equal, bilateral, and it's not labored at all. Okay. I would also teach the patient how to use an incentive spirometer. At this point, the patient would be taught to exhale the patient would be taught to inhale into the incentive spirometer. We would talk about goals, and we would educate the patient at this point on the importance of the IS and how this could prevent future illnesses down the line. Okay. All right, my dear. So we are done with the assessment. I'm going to give all of this information to the doctor, and then she will be in to see you, okay? Thank you so much.
Thank you.
All right, have a good one.